morning, everyone here. Well, I've got like 40 slides to introduce the topic, so I will start just, quite fast because otherwise this is not going to work well. So, but first of all, I will start by introducing what I'm supposed to tell you here and now. So I will just tell you a story what this is all about. So let's go back to, let's think about year 2020, 2021. The GDPR was already rolling, so everybody was adapting to the GDPR, and it was a full disaster in so many ways when everything was related to health data. Why it was such a disaster, such a mess? Well, Dara said it was due to a very simple circumstance. When the GDPR was approved, I think they didn't have in mind everything related to artificial intelligence revolution or anything like that, because artificial intelligence at that time, there were only some freaky people such as us that were on that, In these days, it's quite curious. It's the opposite. You're a freaky if you don't know nothing about artificial intelligence. So time changes quite fast, okay? But it has only been like 10 years since the first drafts of the GDPR were available. So they were just thinking in the old terms, considering, for example, that most people could be empowered in order to make decisions about their data. So more or less, they were just considering, well, we will try to make the data available, but we have to consider people's opinion and so on. It's very important to keep them empowered. This doesn't work in practice. This is just due to some different reasons. One is that we don't have time enough to, just take care of whatever we are doing with our personal data. It's too hard. Second, because there are a lot of people that are simply idiots. So if you want to protect them, you cannot count on them. Yeah, there are like, 5% of people start drinking bleach whenever they can. So you can not really rely on them in so many things. And this is a great problem. We all know, for example, that for research purposes, people are not willing to provide the data, but they just show the data in all social networks, and it's not coherent in so many ways. So one of the main problems that we have is that we are really not profiting from our data for what needs to be done, and still people are not being protected for most of the misuses that might happen from data. So the Commission at some point more or less realized that they had to do something, because the GDPR more or less decided something like this. There's like different legal basis for data processing, like 6 of them. But in so many countries, in the case of health data and so on, there was no a kind of a national regulation that made it possible to start processing data of special categories and so on. So for example, in Germany, in Poland and so on, mostly everything was going on the basis of informed consent, and it didn't work. So the Commission just said, we have to do something. They started with a new framework that was based on the idea of data spaces. For those who are not familiar with that, the Commission is now trying to create some different data spaces and try to develop some specific regulation on these data spaces. At this very moment, I think there are like 14 data spaces that have been thought. Some of them are related, for example, with mobility, some of them are with tourism, some are financial, and of course, they've got a health data space. That's the first one that has been really developed. That makes perfect sense because those are the type of data that we really need to start processing in these days. It's the most urgent task that we have to do. So the Commission just in I think it was like in 2022, they just unveiled the first draft of a new regulation that was specifically related to health data. And this was the health data regulation. So in the first draft of the Commission, this was a very revolutionary document because they were just saying something like that, forget about informed consent, forget about the patient, they have nothing to say about this. We will just start processing all this data. And most important thing is to try to introduce the adequate safeguards in order to protect people. So let's try to make it possible, protect people, and start processing this data and make research and developing of artificial intelligence possible at the EU level. I guess that you also know that we are now in a quite troublesome moment where some older countries such as the United States and China are just developing AI in an impressive speed, and we are not doing so. So we all know how things work in this world. So they just did something like that. And of course, there was a lot of opposition to this idea, especially at the EU Parliament, where some concrete political groups started fighting about that. So after the negotiation, the new regulation was approved. I think it was in March 2025, if I remember it well. So and it's gonna be enforced like in March 2027 for the Commission and for all of us in 2029 for most of the clauses that they got there, especially for everything related to secondary use of data. That's one of the things that is most important for us. There's also another part that is related to the, to the primary use of data and so on, but I will not get into that. So the point is that this regulation will, at the end of the day, introduce some new obligations for everyone at the EU level. First obligation is that whoever's got a kind of data set, they got to tell a lot of things about that, meaning that they will have to reveal that. So whoever's got a data set, they will have to say, okay, I've got this data and the specification of this data set. So there will be kind of a standardization. There will be some kind of levels related to the data sets, telling everyone how this data have been obtained, what has been done with this data, whether they have this kind of quality of these other ones. These kind of standards are being created in these days. If I remember it well, it's Quantum in Zaragoza who are taking the lead of that. It's an international consortium, but led by Zaragoza. And these should be ready by the Commission in June 2026, these standards. Once we get them, everybody will have to deal with that and start preparing the databases and the information about the databases. That is what's going to happen. Only exceptions about that are micro enterprises and individual people and so on. So for example, if you are a physician working in France and you get a small database, you don't have to declare it. And by the way, France will have a huge problem with that because the way that they organize the healthcare is totally different to us, for example. So the point is that once we get this catalog, the game is going to start. What does this mean? Well, the regulation just defines three categories of people in there. One is what they usually call data holders. Those are the ones who got the data. Hospitals, a pharma industry performing clinical trials, insurance companies, wherever you could think that they really have kind of health data. Then you get a second important main character, is what they usually call data users. Those are the ones who are willing to use this kind of data, okay? So the ones that would like to perform kind of research, kind of innovation, kind of improvement of the quality of whatever they want, or the ones who want to make teaching or anything like that, because those are the ends, the goals that would be allowed by all this kind of new regulation. So the point is that you will have a user, you will have a holder. Of course, users will be willing to take a look to the data and use the data that the data holders have. So how does it work? There's an important piece that I'm not telling until now. That's what is called the access bodies. Okay, so access bodies will serve as a kind of intermediary in between both of them. Access bodies will be administrative bodies, meaning that they will have a kind of public authority in there. Okay. So all member states will have to nominate at least one access body, okay, but they could nominate much more than this. In this country, for example, I'm pretty sure that there will be at least 18 access bodies, one for each comunidad autónoma, and then at least one for the Ministry of Health Care, that Ministry of Health that will be the ones leading everything and will be the contact with the rest of the EU. Once we get it, then you have a basic infrastructure, okay? And the procedure in order to gain access to the data is quite simple. If you are a data user and want to use the data, you will have to first identify what is the data set you are willing to use. Then you will have to take a look to the data holder, see who it is, and what is the access body it is connected to. And this will have to be defined in each member state. Once you have it, you will have to go to the data access body and tell, hey, I want to use this data, so please provide me a kind of data permit in order to gain access to this data. The data access body will take a look to your application, will see if everything is all right, if this is doable or not, what will be the cost. There will be some kind of a fees in order to do so. And if everything goes right, they will provide you with green light. There will be a permit for like 10 years, okay, that could be extended. And they will have like 2 or 3 months in order to give you an answer. Then the data holder will have like 3 months or something like this in order to prepare the data, and you will be able to gain access to those data. If you are thinking or considering what type of data, well, all type of data. In this case, the new regulation does not make a distinction in between personal and anonymized data. Everything will be available. Only difference is that aggregated data could be transferred to the data user, but personal pseudonymized data will always remain where they are. So it will be a kind of federated infrastructure, meaning that, for example, if you want to train an AI tool, this AI tool will go to a kind of secure space created by the data holder where the AI tool will be trained, but no data will go out from the secure space. It will remain where it is. So it's a completely federated structure. Okay, that's how it's going to work. But it will be possible to transfer the data if those are anonymized data. Okay, this could be doable. Indeed, the one who is asking for the data will have to justify why they are willing to work with pseudonymized data instead of asking for anonymized data. But because in theory, it is much more safe to work with anonymized data, even if in practice I got some doubts. But in theory, it's the way it is. Okay, so that's more or less what we get. If you are making some other questions, well, first, this system does not replace the traditional system that we are using right now. It's complementary. You want to work with that, you work with that. You want to go on in the old way, that is go to kind of to a hospital here in Guipúzcoa, you go as Tecnalia and you ask for some data or whatever you want, this could be done, and you don't need to go through this kind of a structure. But if you are willing to proceed with that, this will be a very nice alternative, especially if you're willing to work with few amounts of data and so on. Why is it going to work so well? First of all, because it's compulsory for everyone to provide you the data once they get a green light from an access body. Second, I am the president of an ethics committee. We will be much more relaxed with this system, okay? Because the problem is no longer going to be us. Yeah, we are going to be a problem. We will always be a problem for you. Also a solution, I guess, but we will always be. So you will come to me and I will tell you those are the problems, but I will not get into for example, the impact assessment and all these kind of things, because I'm going to say, no, the access body will tell you. So go on, and be lucky with that, okay? But I will not be the problem, okay? So I will be the nice chap. So only for this kind, yes, I'm so happy about this. So the access body will be quite reasonable, probably more than us, and they will provide you with some solutions to whatever you want to with all those data and so on. Those secure spaces will be there and they will be created, and more or less everybody will be sure that things are gonna work well. If you want to get data from different data holders, you will have to get permission to all the access bodies. Okay, they are connected to you. In theory, it would have been fantastic if you had just one read light with all of them. We are quite unconfident to each other, I guess, so it didn't work in practice. Okay, so you will have to obtain this. The Commission will provide a kind of infrastructure in order to create this kind of federated thing, okay, in between different data holders in different EU countries. This is like a fairy tale, of course, but I think that in practice somehow they will have to deal with that. So I guess that in some years this will be available in practice. Of course, this costs a lot of money, and one of the main problems that comes to my mind is who's going to pay for this. That's one of the main problems. It's not so clear how. Each processing will be paid by the fees, yes, but who's paying for the whole infrastructure? Who's paying for all the terrible, work that means pseudonymizing data, creating secure space is not so clear in practice. Second, most researchers are asking me, but what's going to happen if I got this data, I have created this data, those are kind of my intellectual property. Sure, I have to let everyone else take a look to those data and profit from my work. That's not so clear, but in practice, what the regulation is telling you is that all intellectual property rights will be protected, and access bodies will be the ones telling how those will be protected in each concrete permission and so on, okay? So we will have to see how it works. Of course, there will be a kind of body, that will try to harmonize everything and try to make them all work in the same way. Let's see what happens in practice. This will be quite similar to the EDPB in case of the GDPR. I guess that you are able to know what acronyms are. Otherwise, just ask me, okay? So the point is that this is the way that the whole system is going to work in practice in the future. I guess that you got a lot of questions about that because it's almost impossible not to have a lot of questions about this. So if you want to make me some questions, please do that. Otherwise, I will go on with the 40 slides and it's gonna take some time, okay? So if you're not, I will just make you a last tip, okay? By the way, I will not gonna introduce any slides if you are, worrying in these days. I will just talk whatever I'm saying. The slides are only just for you to take them home, okay, and keep them with you as a nice souvenir of this kind of talk, okay? I'm not gonna use them. So the last part that I wanted to mention was just that, like 3 months ago, no, it was like 5 months ago, the Code of the European Union they had a new ruling about what I usually call the Scania doctrine, and this is very nice because it's going to change a lot of things about pseudonymation and anonymization of data, because in these days, this is quite simple to know what pseudonymization means, meaning that in general, that's something very objective. Data are pseudonymized or anonymized data, and they are like that for everyone in this world. According to the Scania doctrine, this is going to change. And the idea of anonymity is going to be quite related to the subject, meaning that, for example, imagine that you are the ones who are the data users and you want to gain access to kind of a data set, and someone is providing you this data set without any kind of codes. You could say, oh, those data are anonymized in my case because I cannot really know who are the patients on that. But they will not be anonymized data for the one who is providing this to you. This is precisely what the Scania doctrine is telling, that pseudonymization or anonymization could be very relative to the subjects that are processing the data. And this is going to make us all become crazy in practice in so many ways. And we still have to define what's going to happen with this. It's not so clear, and we have to develop a lot of new clauses related to this. If you want to know anything else about this, I will be at your disposal, okay? If you want to make some other questions, I will just give you two final tips. One is that if you are considering what's going to happen with patients, what was the nice end of this story? Well, the nice ending of this story is that the final version of the regulation made a kind of compromise solution. And in these days, this regulation will be based on a kind of opt-out system, meaning that all patients in this world will be able to tell the governments that we don't want our data to be part of this kind of new architecture, so please don't use them for research purposes. And this will be doable. That's an opt-out system. There will be some exception in case of those data are really necessary for especially interesting research related to public interest and so on. Your kind of opt-out will serve for nothing. That's what's going to happen. And there are not so many other things. I just could tell you that, of course, there will be impossible to use the data for purposes that have not been declared, and there are some very nice sanctions for those ones who are trying to cheat the system. Okay, so in practice and supposedly everything more or less works quite well. I'm not gonna say nothing else. I think that I spoke a lot. Yeah. There's some people who are saying yes, of course, just spoke too much. That's good and nice.
Yeah,
good to know. I'm not gonna tell you nothing else. I will remain here for I will have to leave for like half an hour. I will come back and I will be here until 2. So whoever wants to make questions, I will be available.
We don't have any question online either, so if you don't mind, we can do this session at the end when everybody speaks.
Okay.
And we can go for the next.
Okay.
So thank you very much.
Thank you.
Thank you.